should come up on your screen too.
I see it.
Sweet. I'm excited. All right. So I guess we should probably start with like introducing yourself. So I'm Michaela. I'm an RN, New York State. I'm not currently practicing because of COVID. I got some different circumstances, some high risk people in my life, but I was in the ER, and I really want to get it out there as far as information. Lots of different topics too, but like going from nurse to doctor, or really whatever you want to talk about, your experience, COVID, and your story. So I'll let you go first.
Okay. Hi, my name is Paige. I also was doing YouTube for a while too, but I hate editing, so I quit. So I'm a CNA, and I just finished my third semester of nursing school mid-COVID, so I haven't seen an actual patient in clinical for like 8 months, so that's interesting. All online patients. And currently I work on a ortho floor as an extern, so I'm getting at least some experience in. And I was talking to Michaela about, thinking about going to med school, down the road, and that's how we started talking.
So you haven't been able to work with patients in clinical for most of your degree then?
A decent amount of it. I got first semester and half of second semester, so.
Yeah, that makes it really complicated.
Yeah,
I know you were talking about, you had this whole plan written out, and I saw it and I just lit up because I was like, oh my God, this is exactly what I've been doing for years. I have an entire plan written out in my head on paper and everywhere. And I don't know if you've talked to other people about it, but it looks really good. So are you working on your bachelor's now or your associates?
I've taken 2 courses of my bachelor's because they let you sort of like pregame. So I've only done 2, and I hope to start after May of 21. But yeah, I haven't told anybody that because it just seems like such a pipe dream. So
I know, that's what people say. Everyone's like, you should just be a nurse practitioner. But I don't know if I can't remember if we had even talked about it or not, but like everyone's under this impression that you have to have either a chemistry or a biology degree as a bachelor's. And I'm going to try to say anything that doesn't not try to not say anything that will get me in legal trouble because I don't want to be inaccurate. But in all the research that I've done, they really don't care necessarily what degree you go for as long as you're super passionate about it. And actually, one of the things I wanted to mention to you too was, I don't know if you have seen this too, because I'm pretty much home for the most part, quarantining without quarantining since I've been home since April. And so, oh my God, I have to find a way to make a difference. But anyways, they're looking to see what nurses are doing in the pandemic to make a difference as far as being an applicant for medical school. I was reading on the Forbes article last night. So there's like all these virtual volunteer opportunities. And that one was a new thing to me. There's like a whole list if you look up Forbes articles on pre-med students. So you haven't been in any clinical setting as far as any specialties then, right?
No, it's pretty much been all med surg and ortho. Like that's all I've gotten. And of course, long-term care. I got that from my CNA time, but yeah, I haven't seen any specialties. So the thing I sent you was just my assumption about those specialties. I don't really know. I did a little bit of volunteer experience with labor and delivery, so I got to see a little bit of that.
Okay.
I think like 40 hours through the Red Cross. I volunteered.
Oh, nice. So they go over do they go over content now? Because it's been a while since I've been in school for it, as far as the different types of areas, or do they not really touch on that?
Yeah, my course is kind of, I think normally like they go through like fundamentals and stuff like that. So ours is kind of odd. It doesn't do that. So we kind of go through disease processes. So we don't really have like the fundamentals, the med surg. So I'm not sure how. I think most people are probably through that other process, but yeah, they don't really tell us too much.
Yeah, it's kind of scary going into it.
You're flying blind.
I feel like I was kind of going in blind, even though I wasn't in like the whole pandemic world when I first started. I didn't really know what the heck I wanted to do, but I feel like in my opinion, it comes down to a matter of like your personality type and your lifestyle. Like personally, like I have kids, and full disclosure, I'm ADHD, so I'm always super busybody and only work under pressure. So I love the ER, and it's care, and there's constantly you're constantly learning new stuff on a daily basis. I miss it so bad, but and you have a lot of autonomy there, but it depends on what you want. And actually the ER, because I think you had mentioned that. I
I
know in
did.
New York State, as far as what I've seen, I don't know if it's all facilities or if they may have changed it due to COVID. They wanted at least, I think, 12 months of med surge experience prior to applying, but they may waive that for COVID. I'm not sure on that. But and then you had to get ACLS, PALS, and there's a couple other certifications. But in my opinion, it's very much worth it. It's really stressful, but fun at the same time. There's a lot of learning there; it just never stops. And then, do you have kids? Sorry.
Yeah, no, I do. I have a 3-year-old.
Okay. Yeah. So I, I don't know. I guess I would help me to kind of gauge your personality a little bit more. But like me personally, I could never do an office job. I know you mentioned women's health, and I actually had a couple of people that graduated go into that and absolutely love it. And it's like it was really consistent as far as the hours and the expectations and the skills you use. For me personally, I just remember going through school and like learning all these things. Actually, I thought I knew a lot, and then threw me into the job, and I knew nothing at all. I think probably everyone says that, but if you wanted to focus on that, I mean, it's a pretty stable job, but the pay is a lot less. Like, I don't know what's happening due to COVID, but if you're going into the hospital, you're looking at a much higher rate. And then what was the other one? So you already worked for ortho, right? You said?
That's where I'm working right now. I literally just started. I've had one day, so
Oh,
it's
wow.
mostly just like CNA work. Yeah.
But that's good, though. That would make you a really good applicant when you're done with school. I don't know if they mentioned that to you.
Yeah, hopefully I'll get to work at the same hospital. If not on that floor, then somewhere in there.
Yeah, but if nothing else, do you have prior experience as a CNA or anything before nursing school?
Just a license. I never got a job because I went straight into nursing school.
Well, I think the CNA thing, I think people really overlook that. I wish I went back and did that. And as far as applying to med school, I'm not sure if you've looked into it yet, but they want a certain amount of clinical hours as a prerequisite, anyways, completed before you apply. And then the
I did
bottom.
want to ask you that, like, because as a nurse, that would count as your clinical time, though, right?
From the schools that I've looked at, they'll count that. I don't want to give an exact number. I believe it was 7,000 as a starting point.
It's a good
But
amount.
yeah, I've talked to a couple doctors, and that was a couple other things I wanted to say. No one really told me this because everyone looks at me, yeah, like a pipe dream, or like I'm totally crazy for wanting to go be a doctor, and I'll never have any money because from what I understand, I'm not going to be able to work. They don't allow you to for the most part, unless things change as a nurse while you're going to med school. But there were a couple things. Some of the physicians that I've talked to in the ER setting have kind of pushed me to go now if I was going to go, but also like making sure you develop some really good professional relationships with them and let them like make sure it's clear to them that you want them as a letter of recommendation when you're applying. Because like me, I had to temporarily resign from my job, but I mean, I left things on good terms with some of them so that as many of them as I could, but it'd be really helpful in the future because they're going to want that just a little bit more than the whole process of getting in nursing school. I was trying to think of what else. And then your science courses, those have to be a certain GPA. They're going to look at those. And there's like a 5-year it's a 5-year where they expire. I'll let you talk.
After your BS, right?
Yeah.
You what?
I'll let you talk. I'm doing a lot of talking.
Oh no, you're good. No, that's what I think that's what a lot of people miss out is like those like nitty details because like you can find a lot of this online, but like the letter of recommendation stuff and like especially for the nursing path because a lot of people go like the bio or their chem majors and then they go in, but like if we already have these clinical hours, do you still like are you still going to shadow a doctor? Because I know a lot of them do that, but you kind of shadow doctors all the time.
Right.
You know.
Well, I know in the ER, I'm not saying, obviously you're not in charge of the residents or anything, but you work directly with them, the residents, doctors, surgeons. So I am kind of biased because you get all of the things and all the specialties all the time. So you do shadow without shadowing, I guess. It's just, to me, really stressful, but like the best experience ever. And you're gonna meet like so many different types of people from like I worked in more of a rural area, so there was a lot of autonomy. But everyone from cardiologists to orthopedic surgeons and constantly constant rotations of new residents going through. And so there's a lot of opportunity to have that there and see what you want ahead of time. So that's part of why I'm pro ER, because they just see it all play out. And then they look at you as a nurse trying to learn sometimes because they don't necessarily have that hands-on clinical experience first before they're coming in. So it's really interesting. But I'm trying to think of what else.
So when do you think you're going to apply? Do you think?
So I am on my third attempt of a bachelor's degree because I have 2 kids, and I tried the first time to go for a BSN, and I was working full-time nights with a newborn, and it was just way too much. And then I tried when I was part-time, working as well, but I was still picking up a ton of work since single parent. And that one I was looking at, little did I know, this one I tried to do a biology degree online through Arizona State University, and it was awesome. Like the entire program was amazing, except turns out the med school that I was going to apply to doesn't accept online biology degrees. Yeah. So that was a whoopsie on my part. But now
I watched that video and I was like, oh no.
I was like, okay, don't do that again.
But I mean, that's good knowledge at least. I mean, that's like a silver lining, I guess.
Don't do the online biology.
Yeah. Except COVID right now, everything's online anyway, so.
I know. Maybe they'll waive it all. I know there were some people that were, kind of pre-med students that, like kids of doctors that I was working with, and they were just letting them do it and all the simulations online anyways, so they might get by. But now I'm doing my BSN, and I'm just pushing the practicum part to the end. Hopefully, well, I don't know what's going to happen with COVID, obviously, but once I finish that, I'm looking to have a bunch of virtual volunteer hours in, and for me personally, I'm looking at using some of my professors as letters of recommendation for my science courses, and then I think I'm going to do my MCAT and just go straight for it. But there's a couple other things. I don't know about, it doesn't really matter necessarily, but there was a couple of things that I did that I didn't realize how smart I was about it at the time, financially, because I've been wanting to do this since since 2013. So like nursing was always intended to be a stepping stone for me, and people didn't really understand that. But it's so like at any point in this whole process, you can just kind of fall back on that if you need to, because med school is really competitive. But and actually, I've talked to a lot of residents who've said they think that, I think it was one nurse who they did nursing school and then med school. And then I had a long conversation with them one day, and they told me that med school is nothing in comparison. I was like, okay, we can do this. It'll be totally cake. But anyways, financially, like when I first started, I thought I was going to be making a ton of money as a nurse, and that wasn't necessarily the case. I wish that I had immediately invested in my own malpractice insurance if you are going to go for the ER, just because you work with a lot of different things, a lot of different legal issues, and got to learn to take a lot of different types of personalities quickly. But putting money aside, because I'm not sure if you're aware of this, but a lot of people are. There's a cap on your undergrad student loans, and once you hit that cap, you're done. And as far as paying for med school, so I've already kind of factored in the idea that I'm not going to be able to work as a med student. So I put a ton of money aside for the purpose of that, so that I'm able to kind of, pay my way through med school if needed. And once you get going, if you do work, I don't know about, office jobs and stuff. I'm sure they have something, but there were a lot of different opportunities within the hospital for you to put things away in 401ks, and they have like flex spending accounts in, actually, they were paying back. You just have to apply for it every year. They'll pay for you to go to school depending on how much you're working. And then, what was the other thing? Reimbursing your loans that you've already taken out. I don't know if you've heard about that, but those ones were pretty big. So I just think that everyone doesn't realize it's possible to do.
I mean, it does seem like a mountain, especially, you kind of have to navigate it yourself, which is why I'm glad that we connected, because now
I know, right?
I'm pretty sure you're ahead of me, so you can navigate it and report back.
Well, hopefully we can keep collaborating or whatever, talk throughout it. I'd like to get a whole bunch of different people who are trying to do the same thing, because it's just pretty much a foreign concept.
Mm-hmm.
Yeah, I don't know. I found in the past when I was looking on YouTube, because I spent a long time trying to find like nurses who went to go be a doctor, and there was like nothing.
No. And that's where I get all my information too, is YouTube.
Yeah, I talked to there's a pediatrician, and there's a couple other people though that had said that being parents or single parents or female or a nurse or something different like that, all those different types of factors, a lot of different things, but they want to see that you stand out. They want to see a non-traditional student as an applicant.
Mm-hmm.
So it actually works in your favor. And I'm already in my head like every day playing out like what my whole spiel is going to be when I stand in front of a panel of people, and I don't know. But
yeah, that is something I want to ask you, because you are a parent. So are you going to move, like, are you going to apply to a big scope of med schools and then move if you get into those, or are you going to apply to the one in your area and then?
So I would like to apply to the one in my area. There's a couple. I'm not going to move far away. I'm already trying to get myself weasel my way in, not weasel, but get myself in with the facility that I want to go to. It's actually Upstate Medical University. It's a teaching hospital, so they have a lot of different nursing jobs. I forget. Did I already ask you? Are you in New York?
No, I'm in South Florida.
Oh my God! Wow.
We actually want to move to Rochester, though. That's where we want. Yeah.
They have an amazing hospital. They're strong.
Mm-hmm. Yeah.
That would be a great opportunity.
Yeah. But
if you do look into that.
Okay. Cool.
Yeah, so University of Rochester is like one of the best hospitals. I can't be biased, I suppose, but in the state.
Well, that makes me nervous then if I'm only going to apply for one. Because I probably won't apply for many either. I'll just have to stay wherever we move.
Right. I don't actually, have you reached out to any? Because I'm a little over the top like that, and I've already emailed I think it was the director of admissions for their medical program or their med student program or whatever, and asked them what I need to do and what they're going to accept or what they're looking for. And they have a lot of even virtual open houses if you want to look into those, because they have a lot of expectations prior to applying anyways, and it's just a really long process. So I don't know, at least for me personally, I'm trying to incorporate that into work now.
Mm-hmm. Oh, that's a great tip.
Yeah.
Because I feel like I'm so far out. I haven't, I've been like too afraid because they'd be like, oh, you're like 5 years out. Like, why are you even talking to us?
No, I don't think so at all. Why do you think you're so far out?
Oh, I mean, I probably would apply in like 26-ish because I won't get my BSN until the 23rd, 2023, I mean. So,
Okay.
I mean, I have a decent amount of time.
Right.
Plus, I got to get a few of the prerequisites that a lot of them want because I had a weird chemistry, so I need to take organic chemistry and stuff like that.
I gotcha. Yeah, mine'll be a little ways out too. So I don't know. I'm gonna have to at this point. I'll have to redo most of my science courses anyways. So yeah, I think there's a lot of people who forget that or we aren't aware of that. So they end up retaking a lot, but
because they only give you 5 years, right? So that's pretty tight. Well, how are you? What about the MCAT? When do you plan on taking that?
The MCAT, I don't have an exact date right now. Before COVID, I was actually looking at, I love trauma and stuff. I wanted to do, so the hospital I was talking about, it's called Upstate, and they have a level 1 trauma center. So I love to go on like critical care transports and stuff. But I was looking at getting my CEN, so you'd be a certified emergency nurse. So it's more focused on getting that so I can have additional things to put out there as an applicant for med school. So I don't necessarily have a date. COVID kind of put a halt to that. And but once I finish this degree, I don't think I'm gonna wait at all. I'm just gonna go. I'm gonna try to set everything up as far as bugging the crap out of the hospital until I finish my degree.
Yeah.
And then I think you said you're starting your BSN. My plan is to try and do all my practicums at the place that I'm applying so that they see me all the time. So I don't know. And then I think a couple of the other things, I don't know. I'm sure they have to teach you some information about it, but they talk to you about like the interviewing process for your first jobs when you get out and your resume and all that.
For my first nursing job?
Mm-hmm.
No, I haven't. I don't know anything.
Okay. Yeah, there was I'm sure it varies quite a bit, but depending on what you choose, I wanted to send you a template because I paid a lot of money in the beginning and it was so worth it to have someone design basically a nursing resume and cover letter for me. And of course, I don't know how it's gonna work with COVID again, but like I didn't hear back from like anyone. So I just had to keep following up until someone would finally answer me. And then literally showing up at their door of the hospital over and over until it was that annoying. But a lot of times in my experience, they try to put you on night shift if you do decide to go into acute care. I don't know if you've heard that yet, but I did that for Oh, it's like 6 months. But I don't know how you are as far as night shift stuff, but it was not my favorite at all.
Yeah, it's like hit or miss for some people. That's what my shift is now, as
Oh, is
as
there?
an extern. Yeah, so I'm used to it. From I don't know if I mentioned, but I was in the Navy, so that was my shift in the Navy. Yeah, so used
Yeah.
to it.
Well, then that'll open up a lot of job opportunities for you because there's a lot of people that don't want to work night shift as a nurse.
Yeah, the differential, I don't understand.
Yeah, no, I don't know. Good props to you, man, because I did not do so well working nights with kids. But
Well, I haven't done nights with kids, so that is going to be a new thing.
my kids wanted me up 24/7 all the time, but it'll make things a lot easier for you. Um, so anyways, you're gearing your resume towards whatever the facility is and whatever specialty you start looking at, or if you're like med surge is like a, I don't know if they talked to you about this yet either. It's like the basic foundation for getting into anything. So if you have that, you're opening a lot of opportunities. Personally, I did not like it at all. The patient to nurse ratio was extremely high and it was constant work. And it was an orthopedic med surge floor. So um, it just seemed very routine and that's fine and all, but I'm not much for that type of thing, like a little bit of adrenaline. Um, but if you have the 1 year of med surge, you can branch off in a lot of different ways. And as far as the OR, I think you mentioned that one. They
I
have
did, yeah.
extensive orientation. And what I didn't know, which you probably already do, because you seem pretty smart, they, as an RN, they want you to, no, I'm serious. They have you be a circulating nurse. So you're not actually assisting. And I talked to some people that went from the ER to the OR, and I'm like, how did you like it? And it's, you count a lot of instruments and you're basically overseeing the entire procedures, but you don't get the hands-on. So I guess it depends on which type of role you want to take on. You're more of a managing type role from what I've been told. But still, it does open the door if you're looking to do, surgery or med school stuff in the future, put out there too.
Yeah,
But
it's hard to know. Like right now, because I don't know anything, I kind of want to see everything. So I feel like they're going to be mad at me because I'm going to apply every 6 months, be like, now can I go over here?
no, that's the perfect thing about it. I didn't realize that either. Like you can just bounce around everywhere, and then it's just like building your whole resume up with experience too. But if you are in a hospital, like we can go to a lot of different areas without necessarily changing your entire job.
Mm-hmm.
But I don't know what your personality really is. Laid back, high strung. Meh. I'm like the stressed out, high strung, like meh type.
See, I feel like I'm drawn to emergency med, but we had like a code my first day, and I was just like, I just stood there and I was like, well, I guess I should cross emergency med off the list because I just like froze.
No,
But I mean, it was my first day though, so.
I have like an almost identical story. They had me go to long-term care, and I didn't have any clinical experience, and it wasn't a code. It was an almost code, and I thought it was a code, and I just like totally froze up, and I went to go find my room, like help, help now. So if that tells you anything, I've come a long way.
Yeah, I tried to get into a nurse externship in emergency med, but then COVID hit. Like I interviewed and everything, and then it was like March, mid-March, and then silence, radio silence. I'm sure they were packed, so.
Yeah, you gotta keep harassing
Yeah, but the person I interviewed also left. She went to a different job, so it was kind of in limbo. But
them.
it's good. I'm in now, so
There you
that's
go. Well, we got a good start. I'm trying to think of anything else that was meant to say. Oh,
Yeah.
I've had, yes, go ahead.
Oh no, I was just gonna say, I hope that that was helpful for somebody,
I'm sure.
in our.
I've had a lot of people, literally everyone I talked to except for like one person has said like this is completely impossible. You're insane. What are you doing? I just got in an argument with two nurses like a couple months ago about why I shouldn't go to med school and I will be dead by the time I even finish. And I'm like, don't, I literally do not care. I do not care at all. But I've ponder or I've kind of like questioned the idea at times just because, having kids, like you have to make such a financial sacrifice. So I guess that's another big part of it. But I talked to a pediatrician who had, and this was like my aha moment, like, okay, it's fine. She had 3 kids throughout med school and her residency. And she's like, there's absolutely no reason you won't be able to pull it off. And there's a lot of different, like even childcare opportunities when you have to be in lectures and stuff. So from what I understand, I'm sure there's a lot more. So all the doctors and med students, like, don't quote me, but it's like 80 plus hours a week. But it's worth it for me.
Yeah, I was thinking about that too. I was just like, you kind of think about your why, like, why are you doing this? Especially because it's so much money and like I'm already in a career and, you just like, should I put my family through this,
Right.
But I'm like, I don't know, for some reason it's like a drive. Like I want to continue education. This is just like something, it's kind of like a pipe dream. Like I think about it, just randomly. I'm like, oh yeah, but what if I did that? And I don't know if that's the same for you, but.
Oh, it's the same.
Yeah.
I love it.
Okay. Well then, we're on same page.
You nuts. I feel like if you keep thinking about it, they're just gonna regret it if you don't do it.
Yeah.
I see many nurses who are so unhappy, it's not even funny. And I'm just like, what are they even doing? They're miserable. And not to say that, some people don't love it as a permanent career, but like, it's very obvious that they're not content. So I'm just like, I can't just sit here and only do this for the rest of my life. And I don't know, after a while, it's like not having not the authority, but you don't have control over things that you might want to do a lot differently as far as, especially in an emergency setting. Sometimes it's like really upsetting. It's like, well, if I was a doctor, I would have done this, 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 and this, but I can't do that. So it really just pushed me even more. What is your why?
For me, it sounds really selfish, but like in nursing school, you like, because they're like, what would you say to a patient? Like, what is the best thing you would say to a patient or something like that? But like, I really want to focus on like why this is happening to them. Like, we kind of like skim over the science part of it. Like, we learn about it, but I want to like, I think it's like my why. Like, I always want to like, why? But why does that happen? Like, I never left that 3-year-old stage. I'm like, but why?
No,
So that's exactly why. I just want to like absorb more information.
I think you made the right choice then, because I have the same exact way, and that is me to a T with everything, and I need to know why this is happening, and it makes me so upset that as a nurse, constantly, like the go-to statement for people to say to me is like, stay in your lane, Michaela, and you're not a doctor, why didn't you go to med school? Because I'll be like following around the doctors and residents and surgeons. I'm like, so why are we doing this? And what is going on here? And you need to explain this to me. And like, please draw this all out for me. And they're like, what are you doing? So just like actually delivering, the care is great and all, but just not getting that piece is really frustrating sometimes. So I think you're a lot farther than you think. You're gonna do it.
I'm still scared to tell people. Like, I've only told my husband, and he's like,
I'll
that's
tell him for you. You're gonna be a doctor. No, you got it. You got it.
I'll be
I'll let
like 37 when I want to even apply. So I'm going to be one of the older doctors in the class.
you cares. I'll be like, that's fine. It doesn't matter.
Yeah.
Just add to your non-traditionalness.
Yeah, exactly.
I think they only accept a certain percent of each ethnicity and all these different statistics I was looking at, and I didn't realize that was a thing either. So I was like, oh, me being a Caucasian apparently is not going to be in my favor, but that's all right. As long as you got the drive, and this sounds all very good. And if you want, I can send you the template as far as the resume too, because it helped me quite a bit.
Sure. Yeah. I mean, send me everything. The whatever virtual volunteering things you're doing.
Sure.
See it.
I think that's about all I got. Me personally, I just remember my, I don't know how personal I've gotten on YouTube, but my daughter was on ECMO when she was born. I don't know if you know what that is.
Is that a ventilator?
So it's a lot higher than a ventilator. It's the highest form of life support. Um, yeah, so she's supposed to be dead, but she's not, and there is no scientific explanation to things, which is part of what led me to my why, and I just remember this neurosurgeon uh, coming in, saying if in a few hours, this intracranial hemorrhage because of the ECMO is any bigger, we have to take her off life support, and that's it. And then it just miraculously did not grow anymore. And so it was a matter of that yes or no was going to be your fate. And just the amount of dependence that I had on that one person, I was like, I'm going to give this back to society. I actually just wrote a paper on it, but I don't know, it'll be part of my speech.
Yeah, part of your why speech.
Yeah, I think about it in the shower a lot. Pretend I'm talking
That's
to
the best time to plan it. I don't know why.
Yes, that and the car, and it's all good. But you got anything else? I won't keep you all night.
No, I'm just going along for the ride right now, seeing where life takes us.
All right. Well, if you end up in New York, like we should meet up sometime post COVID.
Wow. My husband has like 2 more years of law school, so
Oh,
yeah.
very nice. Well, I'll be here. So I'll email you some stuff, but hopefully this is useful for other people out there trying to do the same thing.
Hopefully. Yeah, that's what I was trying to do too on my YouTube channel, but I really hated editing so much. I was like, nope. So thank you.
We can just keep doing it, but I'll let you go then for now if you're all good too.
Oh, I'm sorry, I didn't hear what you said.
Oh, I'll let you go for now then if you don't have anything else.
Okay, yeah. Any other time, I'd love to talk.
All right, me too. All right, thank you so much.
No problem.
All right, good luck.
Thanks, you too.
All right, bye.
Bye.